Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. This week we're talking about SI joint pain, aka sacroiliac joint pain. What that means for those who have it is low back pain that's off to one side, feels like a nagging type of pain whenever you stand or maybe you walk. If this sounds familiar, you're going to want to stick around and learn more about this in this week's video. So again, today we're talking about the SI joint. SI is short for sacroiliac joint. The sacrum is here at the very base of your spine, and on either side you have an ilium. So the SI joint is just a shortening for that joint. Now the SI joint is not extremely mobile, but it does need to move a little bit. So if you can see, this is the sacrum here, the two ilium on either side, and when you walk or run, it has to kind of shift back and forth. It has to have just the right amount of motion, and if you have too much motion there or not enough, you're going to start to develop SI joint pain. Now SI joint pain will feel like you're at the base of your spine off to one side, either the left or the right. It can feel like a pinpoint pain right in here, or it can feel like whole left or right side of the low back, like you just put your hand right here and it kind of spreads out, because it can refer pain up or down the back or into the glute. So when will you feel this pain? People often feel it when they go to stand after they've been sitting for a while, or if you bend all the way forward or extend backwards. Sometimes you'll feel it when you twist or side bend, and it will cause that same either pinpoint pain or radiating pain into the low back. So with the SI joint, you can injure it in a load of different ways. You can have like a weightlifting injury, sports injury. It can be that this joint is too stiff, it's not moving the way that it should, starts to get inflamed, causes it that way, or it could be that it's unstable, it's moving too much, and that's a problem there. So the key to fixing that problem is the accurate diagnosis. You need to know what's going wrong at that joint, the junction of your low back and your pelvis. The way that we treat that, if it's too tight, then usually there's some type of tightness about the muscles in your low back or in your pelvis, and we go about a very picky process of using soft tissue work to loosen up those muscles, decompress that SI joint there. If we want to encourage proper motion of the joint, we can do chiropractic adjusting of the SI joint. There's several different ways that you can adjust that SI joint. And if it's unstable, it's moving too much, then first of all, you need to know that. We'll diagnose that, and then we will use rehab exercises, some strength and conditioning to bring some stability to that low back. Usually that's brought on with some stiffness somewhere else, maybe in your low back or in your legs. So if this sounds familiar, if you have some low back pain off on one side or the other, or you know someone that does, then give us a call. We'd love to help you with it. We see this kind of stuff all the time. If you like this video, please remember to give it a like. If you know someone who needs to see this video, please share it with them. And if you have a comment or question, please leave it with the video. This has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.